Hello, and welcome to the online version of the information session for the Respiratory Therapy program here at Northern Virginia Community College. Review in this session is mandatory because it is part of the application process for the program. This session lasts approximately 20 minutes, and it is an acceptable substitute for the mandatory information sessions that were held in person at the Medical Education campus at Northern Virginia Community College in Springfield, Virginia. Sprinkled throughout this presentation a variety of depictions of therapists and the patients we serve. People will ask, what is a respiratory therapist? A respiratory therapist is a clinician who provides hands-on care for people with a wide range of medical conditions related to the cardiopulmonary system. Our 2-year program trains you to work with high-tech equipment in the intensive care units and, of course, our patients that range from big bag bikers to premature babies and everything in between. Before viewing this presentation, please print out the following items and have them available as you watch this slideshow. Getting started. The following information can be found on the right sidebar of the Respiratory Therapy webpage. First is the Respiratory Therapy program description. This document contains the curriculum with the necessary courses listed for each semester and the courses that are needed as prerequisites prior to applying for the Respiratory Therapy program. Second, download and read through the technical standards. Third, you will need to click on how to apply for a copy of the Allied Health application. Download a copy to your computer. This is the form you will need to email in to apply for the program. Fourth, review the frequently asked questions. This can be found on the Allied Health Division page. And fifth, download the request for evaluation of transcripts if this applies to you. You will need to mail this form to the Medical Education campus in order to have your transcripts reviewed. Sixth is the Virginia Math Placement information. This will be discussed in more detail later. Competitive admission will have a math placement component. A prerequisite for the respiratory therapy program is qualifying for Math 154 on the math placement test for NOVA. This was Math 151 and 152. Substitutions will be given for Math 151 and 152 if you have already taken them. This website contains more information about the math placement test, including math placement practice questions. Your grade on this test is good for 2 years. Math 154 is a replacement for Math 151 and 152. This is a short description of respiratory therapy as a profession. Clicking on the helicopter transport image will link to a video with an overview of the occupation of respiratory therapy. Feel free to take a look. In your training as a respiratory therapist, you will learn all about the heart and lungs and how these two systems work closely together. As a respiratory therapist, we will learn about diseases that stem from cardiopulmonary problems, the signs and symptoms associated with cardiopulmonary problems, and the therapeutic interventions to assist patients with these disease processes. One of the primary responsibilities of a respiratory therapist is becoming the expert on our equipment. We use this knowledge to work with other members of the healthcare team to help patients with respiratory illnesses. We also utilize many types of oxygen devices and breathing machines to help patients who have problems breathing or can't breathe for themselves. Of utmost importance is the development of very strong assessment skills to assist and support our patients. These skills and knowledge are the foundation of the critical thinking skills needed to be a good clinician. Other interesting facts about respiratory therapy are your work schedule can be extremely variable. Some hospitals offer 12-hour shifts 3 days a week, while others may offer 10-hour shifts, and some still offer 8-hour shifts. In the hospitals, you can work days, evenings, or nights. In the doctor's offices or pulmonary function lab, you would likely work 9 to 5 days a week. Most therapists' jobs are very independent. You are given an assignment at the beginning of your shift, and you move around the hospital accomplishing this workload on your own. Respiratory therapists' average starting salary is $46,000 to $50,000 a year. Additional pay could include shift differential, holiday pay, and there's always overtime, which is usually available. The big bonus is working with patients and being an integral part of the healthcare team. This is a very rewarding profession. Respiratory Therapy Awards a 2-year associate's degree in applied science. The program is 5 consecutive semesters because it includes the summer session. There are 2 levels of credentialing in the profession. Students completing the Associates in Applied Science degree, AAS, are qualified to take the National Board for Respiratory Care entry-level exam. Successful completion of this exam awards the candidate the CRT credential. This exam also is used to grant licensure in Virginia and most other states. We have a 95% or greater first-time pass rate on this exam. The highest level of credential for respiratory care is the RRT. You become eligible for this exam by passing the certification test just mentioned. Our program has a 94% pass rate for this exam. Most hospitals require employees to obtain the RRT credential within a certain time frame. Registered respiratory therapists are usually paid more and have greater upward mobility. Our program is fully credentialed by the Committee on Accreditation for Respiratory Care. Requirements. This application process starts with completion of this information session. There is an information session code that will be given to you at the end of this session. You will need to place it on the Allied Health application. Next, you will need to apply to the college online by going to www.nvcc.edu and completing the enrollment application to Northern Virginia Community College. You will also go to the student services at any campus and they will help you to apply. A requirement of a 2.5 GPA or higher is needed from your last school attended. This requirement can be met with the prerequisite courses or other college transfer credits. Next, complete page 5 and 6 of the Allied Health application that you just downloaded to your desktop. Send your transcripts to the address shown. It is important to send your transcripts directly to the medical education campus. You then need to complete the request for transcript evaluation form and submit this form to student services at the medical education campus in room 202. This form shows intent to apply to a major field and transcripts can be read accordingly. This form is available for you to download under the Online Information tab. You may qualify to transfer any number of courses that are part of the Respiratory Therapy 2-year degree. See the curriculum for courses needed. There are opportunities to receive credit for prior learning. This includes transfer credits, prior degrees, international transcripts, military experience, and credit by exam. For more information, click on this FAQ for frequently asked questions. Most will be required to take the college level English placement test. There are some exceptions. This test qualifies you to take English 111, which is a prerequisite for the program. Most of you will need to take the math placement test and qualify for Math 154. You do not necessarily need to take Math 154. If you take the Math 154 qualifying test and do not meet the level to place into Math 154, the score sheet will show you in what level you are tested at. This information will be used to direct you toward a math placement class that will increase your math skills to enable you to take the math qualifying test for Math 154. You can retest annually, meaning every 12 months. Once you qualify for Math 154, the test results are good for 5 years. There are math and English placement test alternatives. Students who have taken the SAT, ACT, GED, or TOEFL IBT within the last 5 years may be considered eligible for English 111. Students who have taken the SAT, ACT, or GED within the last 5 years may be considered eligible for certain math courses without having to take Virginia placement tests for math. For more information, click on this placement alternative link. These are prerequisite courses for entry into the respiratory therapy program. English 111 is an English composition course. SDV is an orientation course necessary for all degrees in NVCC. We recommend SDV 101, but if you've already taken another SDV or STD course, those can be substituted. SDV 101 is an introduction to healthcare. Bio 141 and 142 are anatomy and physiology courses. Each have a 3-hour lab. A grade of at least C needs to be achieved in Bio 141 and Bio 142. A grade of B or better needs to be achieved in RTH 120. HLT 141 is a medical terminology course. NAS 161 and 162 will only be accepted through 2020. The A&P course from the biology department, Bio 141, 142, will be taken as prerequisite courses. The NAS 161, 162 courses from Natural Sciences Department may be substituted for Bio 141 and 142 courses, but the program prefers the biology sequence as these courses will easily transfer to a baccalaureate degree after your respiratory therapy degree. Bio 141, 142 also fit well into the AS Associate of Science degree here at Nova. NAS 161, 162 will only be accepted until 2020. HLT 141, 142 is a 1 credit hour course. If you have already taken HLT 143, that will substitute for this medical terminology course. RTH 120 is a beginning respiratory course. You must receive a B or better in RTH 120 to be accepted into the respiratory therapy program. This course covers the history of the profession, as well as the theory and procedures for patient assessments, including chest assessments, heart rate, respiratory rates, and blood pressures.
If a student already has a conferred 2 or 4-year degree from another college, your transcripts must be evaluated through Student Services to receive credit or waive placement testing. For example, if a student transfers a comparable freshman English composition course to English 111, the requirement is met and the student does not have to take the English placement test. This link lists the procedures for evaluation. For additional inquiries, email askthecro@nvcc.edu. A course-by-course evaluation must be done for all degrees earned outside of the U.S. This is performed by outside evaluation services. They are the World Education Services and the International Education Research Foundation. Questions pertaining to your international transcript evaluation should be referred to the MEC counselor at this web address.
Procedures for applying. To apply to the program, you will need to complete the Allied Health application form. This can be found by clicking on this link or on How to Apply under Documents on the right sidebar of the Information Session web page. This will take you to the Allied Health Division website where you can download the application to your desktop. Read the directions carefully. The application is a fillable PDF, so everything can be done on the computer. Once it is completed, save it. After saving, you will need to email the completed application to apply.mec@nvcc.edu. You must use your VCCS student account and put respiratory therapy in the subject line. Generally, 25 students are accepted into the program each fall semester. This program is now a competitive admission program. The rules that are followed for competitive admission include grades for Bio 141 and 142. A grade of A will be ranked higher than a grade of B, and so forth. GPAs will be ranked, and your math score will be ranked. If math course of 151/154 or higher is on your transcript, this will be ranked for points for admission. Then if the general education courses are already completed, those will also be given 2 points each towards admission. Clarification. The college admission policy for the programs with limited enrollment states that the students are accepted on the following priority basis. 1. Legal residents domiciled in the cities and counties supporting the college. 2. Other legal residents of Virginia. 3. Out-of-state applicants. 4. International students requiring Form I-20. Students holding visas that do not require I-20 may get clarification regarding their status from Student Services.
Students are admitted by competitive admission until the class is filled. After the enrollment period ends and the applications are processed, you will receive an email confirming your acceptance. The number of students accepted is limited by the number of clinical placements that the school acquires. Should you not get into the respiratory program for a fall class, you will need to reapply to the next year's class during the enrollment period. There are 4 clinical courses in the respiratory therapy curriculum. The clinical courses are set up to have a clinician take students into the hospitals to work with patients. RTH 196, 296, and 290 are the clinical courses. Student rotations are primarily from 7 a.m. to 2 p.m. on Mondays and Wednesdays. There are some exceptions. This is subject to change. "25 emails of acceptance will be sent out. Students will have a window of time to register for the first semester classes once fall registration opens. If they do not register, they forfeit their spot, and the next student in line is contacted in accordance with the competitive admission. This continues until we reach capacity or the semester starts."
Once accepted for a class, students will be expected to attend an orientation to the program during the summer. This is mandatory. Other program requirements to complete it prior to completing the first semester of the respiratory classes will include background check, drug screen, American Heart Association Healthcare Provider CPR, physical exam, TB test done annually, flu shot done annually. They will be notified by mail as to the specific date and time of the orientation. These other requirements are hospital requirements for any other student or employee working or learning in the hospital environment. More information about the respiratory therapy can be found at www.aarc.org. This is the American Association for Respiratory Care. Also, the National Board for Respiratory Care has a website that lists all of the programs in the country. Listed here are the courses outside of the respiratory therapy department courses that are needed to complete the 2-year degree for the respiratory therapy program. These may be taken at any time. If you look at the RTH curriculum that you have printed out, we have integrated these courses into the semesters for an appropriate number of credits in each semester. These courses can also be transferred from another college. The CST courses are in cultural communications. Any of the CST courses listed here are acceptable. See the college catalog for full course descriptions. One humanities course is required for the completion of the degree. We recommend Philosophy 227, a medical ethics course which would supplement an allied health degree well. But any humanities course listed in the NOVA catalog is acceptable. A physical education credit is needed, and PED is a fitness and wellness credit that is well suited for this degree. You have PE transfer credits. Those may be substituted for PED 116. This will have to be approved. One social science 3-credit elective course must be taken. You may choose from psychology, economics, sociology, geology, another history, or a political science course. To graduate in respiratory therapy from NVCC, you need a total of 71 credit hours. The respiratory therapy courses are generally scheduled between 8 a.m. and 4 p.m. on Tuesdays and Thursdays. This is subject to change. Some semesters have a Wednesday or Friday course lab section. The RTH equipment classes have 1 2.5 hour lab associated with them. Looking at the curriculum, RTH 151, 131, 135, and 236 are adult equipment courses. RTH 225 is the neonatal course and also has a 2.5 hour lab. There are hospital clinical courses where you work with patients and have a clinical instructor or respiratory therapist with you. These are RTH 196, which is conducted in the general care areas of the hospital. RTH 296 and 290 is conducted mostly in intensive care units and in pediatric and neonatal areas of the hospital. The first 8 weeks of your final semester are in regular clinicals. Then you will precept with a therapist for the last 8 weeks. Precepting is going with a therapist on their normal workday and learning time management skills as well as real-time application of your first 4.5 semesters. Preceptorships may vary in day, time, and day of the week because you are being partnered with a therapist and have to work side by side with them during their shift. The total time commitment each week is approximately 29 hours of class time. Study time is absolutely necessary to be successful. Most students that have been successful in our program study a minimum of 2 hours per night, 5 days per week, or 1 to 2 hours during the week and 2 to 4 hour studying sessions on the weekend. These are guidelines for the number of hours per week that will need to be devoted to studying in order to be successful. All of the information you need to get started on applying for the program has been presented here. 99.99% of your questions should have been addressed in this presentation. If you still have questions, please visit Frequently Asked Questions for Allied Health Programs at the MEC. This is the link. If you have more questions, feel free to call our Program Administrative Assistant at 703-822-6557 or see an academic counselor at the Medical Education Campus in room 202.
Employment and financial outlook for this profession is fantastic. While U.S. job growth for the general population from 2016 to 2026 is forecast to increase by 7.4%, the need for RTs will grow up to 23%. Click on this link for more information about this great profession.
This slide contains clips on the different specialty areas in respiratory therapy. If you see any that interest you, take a look at the career opportunities that await you. This information session completes the mandatory requirement for an information session for respiratory therapy. On your Allied Health application, please use the information session code number 0104. This completes the online information session for respiratory therapy at Northern Virginia Community College.
For additional advising, email an EMEC counselor and feel free to visit their blog at this link.